Welcome everyone. Thank you for attending our webinar, a deep dive into supporting the immune system and combating viral infections. Today's webinar is going to be presented by Dr. Paul Urkel. I am Dr. Navneet Nibber, and I am a medical advisor with AOR. I'm going to be your host and moderator for today's presentation. So before we get started, I would just like to go through a few housekeeping items. So the first thing is there will be a question and answer session allotted at the end of the presentation. But throughout the presentation, if you do have questions, you can absolutely pop a little question into the right side of your screen. You should see a question bar. And we will be going through them throughout the presentation, and some of the questions will be answered right at the end by Dr. Urkel. So please note this presentation is being recorded for future distribution. The content of this webinar has not been evaluated by Health Canada or the FDA. So it's really intended to be educational in nature and should not be taken as medical advice. So you always want to be consulting a qualified medical professional to see if a diet, lifestyle change, or supplement is right for you. So any of the supplements mentioned today are not intended to diagnose, treat, cure, or prevent any disease. So the opinions of the guests, myself, the moderator, and presenters may not reflect those of Advanced Orth Molecular Research. So now that the housekeeping stuff is out of the way, let's meet today's presenter. The esteemed Dr. Paul Urkel. I have had the privilege of working with him. He's a board-certified naturopathic doctor practicing in Ontario, and his clinical focus is really on neurological health, chronic pain, and brain injuries, and is heavily involved in teaching and education. He's, I'm sure you have all seen, frequently writing and lecturing to both professionals as well as the public. He is the medical director of AOR, and his chief mandate is really sharing the science behind a lot of the natural medicine and formulating effective natural health products. So we're ready to begin. So without further ado, I will hand it over to Dr. Urkel. Welcome, and thank you so much for joining us.
Thank you so much, Dr. Nibber. That was a great intro. I'm humbled. It's really great to be here with everybody. Thank you for taking a time out of, I know, an upended schedule for a lot of people. We're all dealing with this Corona situation together, and I think that was the impetus for me to put this webinar together. It was not something that we had scheduled on our docket. We're supposed to be talking about chronic pain, but we moved that to June if you did register for that. So we will still have that. But I thought it was very important that we take a moment to just share a little bit about the immune system, and I think this presentation is really a culmination of probably the last 3 to 4 weeks, definitely in my world, of sifting through the evidence and trying to make sense of a lot of things that that we're all going through. So that's kind of the backdrop. A couple things. I'd like to just bring everyone's attention to that disclaimer again. There's in no way is this supposed to be a treatment or recommendation or diagnosis of any sort. Dr. Nibber mentioned that, so just want to reiterate that for everybody. This is not a public presentation. We did that on Tuesday evening. Was very well attended. It was a great presentation, but this is different. This is much more in depth, and it is meant for people that have a deeper understanding of the natural health world, a deeper understanding of medicine and physiology. So we have healthcare practitioners here with us in the audience. We have insiders from the natural health product industry. This is a pretty intense presentation. I don't say that for a lot of presentations, but there's a lot of information, and I want to get through as much of it as I can. I'm going to try to get through everything that I've set out to, but I want to start off with talking a little bit about COVID-19 and the SARS-CoV-2 virus. And it's not meant to replace anything that the public health authorities in your jurisdictions are sharing with you. Definitely everybody should follow all those recommendations. There's definitely no treatments for COVID that I'm going to be talking about. But what I'm going to be talking about is some of the questions, maybe the misinformation, maybe some of the things that you and your family members have been asking yourselves. And really, these were questions that I needed to answer for myself and for my patients and my family and associates. And so that's really the as I mentioned, that's really why we're going to start off about this. But it also, and anybody that's listened to me lecture before, if you understand physiology about just viruses in general and intracellular infections, meaning inside the cell, it really opened my eyes as I went through this to a lot of the therapies that we have in our toolbox, a lot of the nutrients that we have on our shelves, and we don't fully understand how to properly use them. And there was a couple aha moments, and I will share those with you as I've gone through this. And I have to say, there is no magic bullet herb. I did not go into the Amazon jungle to find something that was previously undiscovered in some tucked away research journal. That's not what's happening. A lot of what you're going to see is some really foundational orthomolecular immune support. We're going to talk about some of the classic and most well-known botanical immune support, but we're going to look at it with fresh eyes. We're going to look at it from the eyes of a situation where we are focused on viral infections. And then if I have time, hopefully I'll just briefly touch on the gut-lung axis. We'll see if we have time to get through that. So I hope to be done here in about an hour and a half and then have some time for questions, but we'll see how it goes. Okay, so what should we all know about COVID-19 and SARS-CoV-2? I put out some videos about just the basics about SARS-CoV-2 and COVID-19. They're on my YouTube channel, and I put them on social media. So if you want to kind of get a more basic understanding, I suggest you check out my Instagram. I did post them all there. What I want to highlight, especially for the group that is in the audience today, is a couple key things that I think a lot of people may have overlooked as they've gone through. So I want to highlight some of these. So the way that this SARS-CoV-2 virus attaches into human cells, and like any virus, it needs to bind to some sort of receptor. And then there's a number of processes for it to get actually incorporated into the cell. What we have now found in the last 2 months is that, like other viruses, this particular SARS-CoV-2 does use the angiotensin converting enzyme 2. Now, if you've heard of that, that's because you probably heard it in your medical textbooks as a key target for a lot of blood pressure medications. It's expressed in the lungs, intestines, kidneys, and blood vessels. And this is one of the reasons experts think that this is the areas of affinity for this particular virus. So it binds this virus, but this is not the only story. There are other things that are now being targeted that have been well known in virology, such as this furin cleavage site. Maybe some of you have done a little bit of reading on it, but this is over and above the ACE2. I'll talk about the ACE2 in just a little bit more, but one of the most important things to understand is that these particular receptors, and I haven't even covered all of them here, but they do play a role in us understanding viruses in general, and definitely the researchers that are looking at the COVID situation. One of the big things is that because of the way that it binds, it is actually much more virulent, meaning aggressive and easily spreadable than the original SARS, which was in 2003. And so we'll talk a little bit about that and some of the differences, but, and I did post a lot of this in my video, so check those out. But that is something that we are seeing as it relates to the way the virus gets inside the cell. Now, once the virus gets inside the cell, you can see here on my screen, you can see that in this diagram, influenza A is the example that we're using here. So this is the flu virus, and it gets incorporated through a number of these enzymes and receptors. But now we've gone to the next step, is that once it gets inside the cell, it basically hijacks the cell to create its own machinery, and so basically replicating viruses for themselves. You can see that this is this big triangle here right below the influenza virus. That is actually all that DNA or RNA material in the case of coronavirus that is incorporated into the body's own cellular machinery. What I wanted to point out here is that there's two terms I want you to understand. Number one is that viruses play a key role in the mitochondria, and they have a key effect on the mitochondria. Our immune response is really dependent on the mitochondria. This is something we haven't heard before. We've thought of mitochondria just as energy power plants. They are key in the sensing of viruses and the body's inflammatory response. Another thing that you can easily point out here, again, you can see is that this ROS in the top right of the diagram, that's the reactive oxygen species. So there's a tremendous amount of inflammation that occurs, and this is what is now termed the inflammasome. And this is a key target for researchers looking at how to combat viruses, especially COVID-19, because this is a case where the inflammation becomes so strong that it progresses to inflammation in the lungs. I'm going to show you a diagram in just a second. So this is a huge key target. And this is something that I want you to keep in the back of your mind as we go through a lot of the things that we're going to touch on today, because supporting the mitochondria, quenching that free radical, huge spike in free radical damage and inflammation, the inflammasome, is a really important thing when it comes to getting a viral infection, having a mild symptoms, fighting it off, and then actually getting a full-on infection. This is for any type of virus, not just COVID-19. And so this is a further diagram showing a couple things. The inflammasome I wanted to show you. I wanted to show you NF-kappa beta, which is down here on the left side of the diagram. You can see that that is something that we've heard a lot about in the integrative world. We know about vitamin C, magnesium. We've heard about N-Acetyl Cysteine. We'll talk about all of those things. Curcumin has been an inhibitor of NF-kappa beta. So the mitochondria are really important at sensing our environment. That's what these MAPs and the DMPs, or they sometimes are called MAMPs or PAMPs and DAMPs. And basically this is just a danger cellular signal response, okay? So there's a ton of reactive oxidative species. Tuck that one away because we're going to be using that and coming back to that again. Okay, so I mentioned that this cytokine storm, this inflammatory response gets out of control as the body's trying to target viruses. The problem is that once it gets too much, this is where you get the example of people getting this acute respiratory distress syndrome. So you're having a tremendous amount of inflammation that occurs that's trying to target a virus, but it starts having collateral damage. So that is a more progressed state. You can see here in this diagram anything from damage to the alveoli, the lining of the lungs. There's starting to be a tremendous amount of inflammation. IL-1B is a huge cytokine that's involved. And there's also coagulation and damage to the lining of the blood vessel. You can see that there's the interstitial space is being affected. And this is why people need ventilators. So this is a common thing about the SARS family of viruses, is they can sometimes cause acute respiratory distress syndrome. So I just wanted everybody to understand that this is kind of what the hospitals are dealing with. And then mild cases of SARS-CoV-2 do not get progressed to this far. I want to switch back to the whole ACE2 enzyme that we were talking about. And so this has been shown that is one of the main ways that this virus gets inside the cell. But the reason I included this tweet from the WHO is that there was this idea going around that maybe NSAIDs, or this class of medications, ibuprofen is one of the most common ones, Advil is another one, may increase the ACE2 enzyme. And if of course the virus is binding with this, then it may actually cause a negative effect. This was actually a tweet by the French Minister of Health, and then it was echoed by WHO, and then within like, you know, a day, not even, they came out with this tweet saying, oh, by the way, there is no association. So the reason I'm bringing this up is that we still don't know what's going on fully. Researchers are just trying to, you know, fly by the seat of their pants trying to understand this. We now know that higher levels of ACE2 are actually protective, and lower levels, like people that have type 1 diabetes, type 2 diabetes, cardiovascular disease, they actually have higher risk. So it's a bit of an opposite. You think that if there's more ACE2 receptors, more viruses would get in. It's not what the research is showing. So we still don't know a lot about it. So just because we know something in theory does not mean that we know what's happening with COVID. The situation's happening so fast, which is why it's so difficult to predict any sort of treatment. So I just want to show you that how things change. Another key question that I've been asked a lot, including by my parents and a lot of friends, is this really serious? Like, the flu numbers are way worse, you know, the 12,000 people being hospitalized and dying from the flu in a year. And I want to show you a couple stats, and I think this is something the government has already been really, even the last week, has really upped its game with, but just so we understand, so we get able to explain it to our family members. A couple things to know. We know these are the common symptoms. From case reports that are coming out, the ones that don't have the shortness of breath, which seems to be 55% of the cases, seems to be that kind of classic sign. They still could have a mild case. They could have a runny nose. They could have a diarrhea. These are a lot less common symptoms, but they still could be one of the symptoms you're experiencing, and they could be still spreading infection. That's an important thing to remember. But the people that do have a more advanced case of COVID-19, they have a lot of really difficulty breathing. And so I've just talked to a lot of frontline workers that are dealing with these more hospitalized infections, and they're saying there is a huge affinity for the lungs, and they're having trouble breathing, and that's really what brings them into the hospital. Another key thing to understand, and I'll show you a graphic in just a second, is that the big difference between this and the flu and this and the original SARS is that the incubation time is from 1 to 14 days. What does that mean? That means that a person could have no symptoms or very limited symptoms for 13 days and be spreading it around to everybody that they meet, like you've all heard on the media, and still not have symptoms. With the flu, you get maybe an incubation time of maybe 1.5 days. So you may be sick and viral titers rising for a day, but then right away you self-isolate because you're feeling really crummy. You may be feeling fine for 14 days. So this is where that whole 14-day period comes from. And so there's shedding that occurs really frequently. And one of the unique things about COVID-19 is that the levels of the virus get really high really fast, and they develop in the nose and in the throat. And so that's where the initial kind of place the virus is actually going to be encountering our immune system. So remember that as you go through some of the things we're going to be talking about. It starts in the nose, it starts in the throat, and then it progresses potentially to the lungs, infecting cells there. This is a great little graphic that I think summarizes a lot of this. The reproduction number is what you're seeing here at the top, and basically you see the big difference between COVID-19 and the flu. The incubation time it's much bigger, and that number, by the way, that 1 to 14 days sometimes changes, may change on certain data. This information is changing day to day. So as I was even really considering, do I even include any of this stuff? Because what I might include a week ago may not be relevant whatsoever, but so far this seems to be okay. And then finally, the case fatality rate, or the mortality rate as being talked about in the media. There is a difference. The WHO came out with 3.4. I want to point out that there is a big difference in this depending on how many tests that are being done, because obviously a lot of the tests are just being done on the people that are most ill, and a lot of the mild cases are being missed. So that will bring that number down, probably closer to about 1%. That still is a heck of a lot higher than 0.1%, which is the flu, but the flu has been fully disseminated throughout the population. So we really won't have a good case fatality rate until we've seen Corona come through the entire population, kind of like the flu. And that's still yet to be seen whether we develop a herd immunity or not. But it's important to understand that this number changes. But one thing that we do know is that it is higher than the flu as far as we know, and that the hospitalization rate is higher. So this is data from the mainland China. This is about 44,000 cases in mainland China. And you can see here, 80% of people get mild. They just stay at home. They might think that they just have a regular rhinovirus, a cold. And then you're going to get hospitalization that occurs in about 15%. And then 5% go to critical care. But when you start doing the numbers here, if you're dealing with 44,000 cases or much higher as you're talking about global cases, you can really see how the hospital system can get majorly overwhelmed with the two orange categories, as you can see here. And then also to point out that these numbers, this is Chinese numbers. This may change depending on the jurisdiction you go. We don't have no idea what's happening in Italy right now because the numbers keep going up and the whole hospital system is massively overwhelmed. And so we don't really even understand that there may actually be a much higher hospitalization rate than what we have found in China. And so that's something to keep an eye out for. And that's how quickly you can overwhelm the hospital system. Another question that I get often is, are young people totally immune? And I want to show this graph because I think it does a good job. So this is from the Globe and Mail. And what this graph shows, this was actually US data. This was in February to March 16th. So almost a month span. I want you to look at the orange bars. The orange bars represent deaths. So this is what we've all been seeing in the media. Really, the older age categories, over 60 is really who's being affected. 0 to 19, 20 to 45, 45 to 55, really, really low cases of mortality. However, what I want to show you is, look at the purple and blue bars. They don't follow the same pattern. Now, these represent hospitalization and ICU admissions. These are not only in elderly. This is actually pretty spread out across the board. And what that should tell you is that this is not mild cases. This is hospitalization. So people that are in their 20s still can get hospitalized, meaning they get severe symptoms that they need to get taken care of. Same with ICU admissions. The difference is that the respirator just buys us enough time for the immune system to figure things out, and for some of the kind of therapies that we just support the body in while they're in the ICU. So young people are not immune to this. They don't die from it as much, but they still get very severe symptoms, and we don't know what the lasting effect of these symptoms are. Could it be scarring? We don't know. So this is just something, just food for thought, that this is serious across the age categories. So I think in summary, we can see this is what I've just talked about. Huge potential to overwhelm the healthcare system. We talked about the death rate already. The way I explain it to my parents is that our healthcare system can handle the flu, plus or minus 10% maybe in admissions. And we can kind of predict that throughout the year, but it can't handle double the flu cases. So even if this was a flu, and which it's not, it still is going to be extremely overwhelming to the infrastructure. And then what does that mean? Look at the death rates here in the first line. The differences between Japan, Singapore, Taiwan, rest of China outside of Wuhan, South Korea has a very low death rate compared to Italy, France. Wuhan itself has a higher death rate, which is why the WHO came out with that 3.4%, is that those are the areas that had the highest cases of ICU and the biggest overwhelming of their hospital systems. This is probably what's going to happen in New York. So there's a big difference in terms of delivering care and the ability to do that with the overwhelming of our healthcare system. And then obviously the economic impacts. I'll let the economists deal with that, but that's incredibly massive. Another thing, a question that people ask, does social distancing work? So I'm a huge fan of history. Anybody that knows me personally knows that I'm into kind of history. And medical history is really interesting, and that's where we can go with for precedent. This is common in law, this is common in medicine. So this is the 1918 flu pandemic, and this is two areas, Philadelphia and St. Louis, cities of a large number of people, even at this time, and they basically show in this graph the difference between Philadelphia first had its case on the 17th of September, and then on the 3rd of October, it put in some rigorous social distancing work. In that 2-week period, they had parades, they didn't cancel events, and you can see a massive spike in cases. This is hundreds of thousands of cases. This is not 250 cases. Where a city like St. Louis had a much shorter duration between the first case and then when they shut things down, 2 days, and they noticed a much less spike, a lower spike in cases. So this is often cited as one of the reasons of early, really strict social distancing works. So here's some modern examples. Japan, mainland China, Wuhan province shut down their borders, Hubei province, with Wuhan being the capital, shut down its borders after 400 cases. And France was at 1,500 and higher, and they still haven't really locked things down. Spain, Italy, you go down the list. Many believe that US is going to be the next epicenter. And the reason is because of this slow social distancing. So I think the evidence right now points to social distancing does work, and it's most effective if done early. If it's done late, you miss leveling that curve. And this is a good example of that. I just included this recently because this is something that came across my radar. Almost every country in the world is following suit with Canada and implementing some very strict border stoppages and flights and the whole thing about physical distancing. Sweden is one of those exceptions, actually, and we know that they have a fairly well advanced public health system, and they have a lot of trust in that public health system, and they've actually followed a much more lax measure. So they have shut down their borders, but they've encouraged people to go outside and not to touch anyone. If you're sick, stay home. But that's really the extent of their measures. So this is something that we can track. We don't really know what this is going to pay off. And their approach is, well, we've kind of missed the boat. The horse is out of the barn, so to speak. And we now are going to just see if what develops, whether a vaccine or whether we get herd immunity like influenza. And so you can see the numbers are much lower than a lot of the big players in Europe. But I'm not advocating for this. I'm just putting this out as an interesting tidbit that is just kind of going to be observed, and we won't know until we see the final numbers. But people are still going out to cafes, they're mingling, they're in restaurants, there isn't the same social distancing. I want to make a point. I advocate social distancing and following public health recommendations here in Canada and the US. We need to do that. We need to follow it. But this is an example of a country that's really taken a different approach, and they, I guess, can get away with it because everybody's doing it. But in Canada, we have to toe the line. Why are kids spared? And so this is another interesting question. A lot of people are like, usually kids are most susceptible to infections and viruses. Definitely the flu pandemic wasn't selective on kids in 1918. A couple theories, very low mortality rate, usually really, really low hospitalization rate, and very mild symptoms. A couple theories, and these are just theories, we don't know. We know that as you get older, lung function decreases, pollution, smoking, etc. One of the reasons that people postulate that Italy has been hit as hard is that they have a very elderly population. They have a high incidence of drinking and smoking, and they're very social. So kids are very social, so that theory doesn't really play here in kids. But they do have a stronger immune response typically when you get younger, and as you get older, you have a less strong immune response, especially the first line of defense. The innate immune system, that is the first thing that will encounter the virus and basically prevent it from getting to be more fulminant, which is a more advanced condition of a viral infection, which we talked about, the cytokine storm, etc. There's also this idea that the ACE2 receptor is reduced as you get older, as well as in people with diabetes and cardiovascular disease, which also increase as you get older. So there might be a number of things transpiring here that are leading to kids getting spared. And finally, melatonin levels are higher. And I'm going to talk about melatonin because it wasn't initially in my presentation, but when I started getting into the research, I was blown away. I use a ton of melatonin in my practice, and so I'm going to share with you some of the pearls that I've seen from the research. Kids have the higher levels of melatonin, and I should also point out that this also seems to be the case in pregnant women. Melatonin seems to be highest in pregnant women. A lot of people are very concerned. I have a lot of good friends that are pregnant, and they work. One of them is a nurse working frontline, and they're very concerned. But the research out of China, where that's now a couple months. In the past, we're starting to understand that they get infected, but they have a very mild infection. They don't get hospitalized. One of the theories, again, it's a theory, could be that in the first, second, and third trimester, you have progressive higher levels of melatonin, with a third trimester having the highest levels. One of the reasons women are, I guess, as sleepy as they are, I think it's one of our body's own protective mechanisms. Very interesting stuff. Okay, elderberry. Maybe you've heard this kind of circulating around. Elderberry is something that's traditionally been used for a long time for viral infections, for the flu especially. I know I learned about it in naturopathic medical school. And there is just recently in 2019 a meta-analysis showing that elderberry supplementation in upper respiratory tract infections reduced the symptoms, especially for the flu virus. Now, compare that to some stuff that's been flying around in social media talking about, well, elderberry may actually increase the cytokine storm. This was an old paper, 2001. This was very mechanistic. This is not necessarily in a clinical case. It did show that it had an increase in this ILB which is IL-1B cytokine, which seems to be the key cytokine that increases the cytokine storm. I'm not saying this one way or another. I'm just saying that there is a lot of evidence for it to be used as a treatment for the flu, but not prevention. So anybody using elderberry for prevention, chugging back elderberry juice, not going to be effective. Once it starts, it can be helpful. There's multiple mechanisms from the purple anthocyanins, but just want to let you know that there is a bit of controversy out there. The bottom line is we don't know. We don't know. COVID's unique. So I've seen a number of my colleagues in the US actually tell their patients to stay away from elderberry. I'm not saying one way or another. I'm just saying this is something that is out there, and definitely the weight of the evidence shows that it is protective for colds and flus. So obviously, to conclude the COVID section, do your part. Yes, physical distancing is important now. We need to be very keen on sanitization and hygiene. Recently just saw a report that maybe hand washing might even be better than gloves, and we've seen this definitely in the mask controversy. Should you wear a mask, should you not? Because in the mask, you touch things and it may not actually get the virus out. Maybe if you're sick and you're coughing into it, a mask might be helpful just to block some of that physical spread, but washing your hands is very, very helpful. Okay, so that was the COVID part. That gives us a bit of a background. Hopefully that answered a bunch of your questions. I know it was a lot of the burning questions that I had, and that hopefully you're able to share that with some of the people in your life and your loved ones. So let's pivot here to supporting the immune system. Remember, these are not COVID treatments. I repeat, these are not COVID treatments. This is understanding the immune system and what we can do to support it in general upper respiratory tract infections. Each one will have its own research that I will talk to. We have a lot of things we need to talk about, but obviously the first case as being an ND, I have to start talking about the foundations. Even though we're socially isolated, we're stuck at home, still do our best to maintain a healthy diet. I know it's really easy for routine to blow up. And so with that comes snacking, chips, stuff that usually lasts a lot longer. We have less fruits and vegetables. So we still have teas. We still should have access to some. The grocery stores are open. So we should be maintaining our colorful fruits and vegetables, our flavonoids, our carotenoids. Green tea is a really neat one. I have a lot of research that I've talked about in the past about green tea and its antiviral effects. Specifically, like the one that comes to mind is the human papillomavirus, but there are many others. And so just drinking green tea could be very helpful for you. You probably have that in your house. And green tea amplifies other things like zinc and vice versa. And vitamin C amplifies green tea. So a little bit of lemon in your green tea actually pulls out the medicinal benefits of the catechins, where milk, dairy milk specifically, there's research showing that it inhibits the effect of the catechins. So just some food for thought. We still should have access to green tea. Physical exercise, stress management, these are foundational. I'm not going to talk about the research. Still have to find a way to stay active, even though we're in social and physical isolation. And with technology, like Peloton and a lot of other things, like I just watched a YouTube video and did an exercise routine for 20 minutes without any weights at home, and I was feeling great after. It's doable, and it's something that's important, especially when we're trying to manage extra stress. And obviously cortisol will suppress your immune system. And so that's a presentation all of it its own, but important things to remember. Thermal stress. I've seen some stuff being thrown around social media is that, heat kills viruses. Let's set a couple things straight. First of all, a lot of that research is extrapolated from being in a sauna for 3 months, consistently using it every second day. That's not the same as heat kills viruses. So there's a lot of great research on regular sauna use, decreases all-cause mortality, improves cardiovascular function, may decrease the risk of common cold, but that is the consistent use of it. So if you have it, you have access to it at home, you can definitely do it. Maybe hot and cold showers is another kind of tried and true naturopathic remedy that has other benefits like stimulating the vagus nerve, which we'll talk about in just a second. But prevention, definitely, I'm a big fan of saunas, but definitely not for treatment. The vagus nerve, this is really neat. And so I want to share a neat clinical pro with you is that one of the things that has come out about this whole inflammasome that viruses cause in more fulminant cases is that the nitric oxide is a key mediator of this inflammation. This is not inducible nitric oxide that is pro-inflammatory. This is nitric oxide that is going to be secreted at the level of your immune cells, and that's going to be secreted at the level of your blood vessels. Humming and other practices like meditation with laughing, humming in general, like humming a tune, all these things have been shown to increase nitric oxide and have a beneficial effects on the vagus nerve. So something as simple as humming on your exhale. So you inhale, try to get a belly breath, and then on the exhale, and you play with the frequencies, but humming in your throat, in your nose, has been shown to substantially increase the nitric oxide in your sinuses and in your nose. And even in your throat, if you're gonna get that kind of type of humming. And why is that important? Because number one, it increases, remember, nitric oxide is vasodilator. It increases blood flow and oxygen exchange into a more occluded sinus. So think of people with sinusitis. And secondly, it is itself antimicrobial. AOR probably 10 years ago came out with a whole line of nitric oxide boosting products. And unfortunately, it was a bit ahead of its time, and we still have a couple of the products in our line like CardioNox and Nox Boost. But AOR has been on this research, and this research group that published this back in 2002 is actually from Sweden, the Karolinska Institute, and they've been talking about nitric oxide and the medicinal benefits for probably 15, 20 years. So nitric oxide is one of these overlooked things. The simplest way we can get it into our bodies, especially areas that viruses first attack, is by humming. So this morning when I was finishing up this presentation, just on my exhale for even 10, 15 minutes, remember just to kind of hum, slowly exhale, increase nitric oxide. Okay, so now we're going to get into some of the nutrients. I'm going to be doing a little clinical pearls about our My Blueprint, which is a genetic test that's available. AOR has it available in stores. You can get it online, but I just wanted to kind of remind myself and everybody that's watching that I'm going to be kind of talking about a couple clinical pearls as it relates back to genetic testing, which I think is always important because it's going to relate to potentially susceptibility. Okay, vitamin C. Now, I debated on, what kind of references do I put in this section because it's so widely understood, and I will give you some for you to take a look at. Vitamin C is important in the immune cellular response. It becomes depleted when we're stressed. It gets secreted out of the adrenal glands when we're stressed, which is why it's always been used in adrenal formulations. And when the immune system, the immune cells themselves, as part of their inflammatory response, they use up a lot more vitamin C. So it's easy to have a functional or a localized vitamin C deficiency. This doesn't mean you have it in your bloodstream. This means that you're deficient at the area where you might be fighting the virus. So you need super physiological doses there. There's a ton of actions of vitamin C, anything from improving neutrophil function, which is our innate immune system. That's the first line effect, to improving T cell and natural killer cell, which is our second line or adapted immune system. Improving microcirculation, decreasing oxidative damage. Remember, this is the key thing as a virus progresses from mild to severe. So oxidative stress is a huge part of that cytokine storm, very important. Some of you may have seen the Instagram post that I had yesterday, and then I've talked about this previously many times. The International Society of Orthomolecular Medicine has been talking about this. Vitamin C is being used, was being used, and still is in Wuhan and in China, and now in New York City. And I think a lot of this makes good sense. Again, not talking about it as a treatment, they're using it intravenously in a hospital setting. So this is not something that we can necessarily have access to when we're socially isolated right now. Frequency does matter. And so the vitamin C peaks in the bloodstream maybe about 4 hours. And for us to kind of keep that up, I think frequent dosing is much more important than big, massive dosing. You don't want to take a ton of vitamin C at the same time because there's a diminishing returns. At about 500 milligrams, the absorption of vitamin C basically is saturated. So you at 500 milligrams, you absorb 100% of it. But then as you get higher, you still absorb your vitamin C, but the percentage goes down. So if you have 1,000 milligrams, let's say you're absorbing 80% of that, that's still more than 500 milligrams. That's 800 milligrams. So it's not like saying, well, we should never dose more than 500 milligrams. If you're willing to take vitamin C every half an hour, then maybe you could get away with 500 milligrams. But taking a chewable Flintstone vitamin 500 milligrams once a day is not going to cut it. We talked about IV vitamin C already. And if you want some great information, Dr. Paul Anderson, a naturopathic doctor, did a great little webinar on that's published on the International Society of Orthomolecular Medicine, isom.ca. Check that out. I think that is a much better place to get a lot of the references and research. But huge fan of vitamin C. By the way, vitamin C is sold out everywhere. And so I've been on full script. Definitely from an AOR perspective, we're working hard to get it back in stock. But vitamin C is one of the top things that people are stocking up on when it comes to their immune system. And so I've definitely upped my vitamin C personally, just to maintain a higher plasma levels, so my immune system has the optimal level that it needs. A quick little My Blueprint pearl here. So part of the My Blueprint, it talks about key nutrients, vitamin D, vitamin E, and vitamin C. And specifically, it talks about the GST-T1 enzyme, the glutathione S-transferase T1 enzyme. And so when we have this enzyme absent, we have an increased need for vitamin C. And again, this may be one of the reasons that unless you do this test, you might not know that you should actually be more diligent with supplementing your vitamin C. And this test is really helpful for identifying that. And so you can see that there. We think of vitamin C for the immune system. We definitely think of vitamin D, which I will talk about, but we don't think about vitamin E. Vitamin E we think of a fat-soluble vitamin. And you know what? I think vitamin E gets a bad rap. I think vitamin E often is overlooked. A lot of clinicians are focused a lot more on vitamin C and vitamin D, and maybe rightly so. But remember, the way that orthomolecular nutrients work is that they work in synergy. They often work together. And I want to show you that, and vitamin E is a brilliant example. So this is a paper from 2018 showing how vitamin E could have a mechanistic influence on influenza virus. And so again, vitamin E is an antioxidant. We talked about that. It also helps support microcirculation. It's typically used in what? Neurological health and cardiovascular health. And I would put in liver health there as well. Immune system is also very important. All those systems need to be used in an immune challenge. And there are a lot of beneficial anti-inflammatory and antioxidant effects that vitamin E has. And you can see some of those here pointed out in this graphic. And so the way that you understand vitamin C and vitamin E and any antioxidant, you should always look at it in synergy. And this was really clear to me many years ago when I was doing research on vitamin E for brain injuries, is that when they started studying vitamin C and vitamin E together, they started noticing actually much more substantial effects. And then the aha moment was that you need to use a lot of these antioxidants together. So just doing vitamin C is going to have a downstream effect on using up other antioxidants. So don't forget that you have to also use vitamin E. Look, vitamin E here is incorporated into the cellular membrane. And so yes, it is more of a fat-soluble antioxidant, but the mechanism that shows you here is that just like vitamin C, quenching hydroxy radical here, you can see the OH, and vitamin E is important at recharging that vitamin C so it's able to function and quench another free radical. So we've known this about lipoic acid as a network antioxidant. Vitamin E and vitamin C are synergistic. And don't forget about all 8 forms of vitamin E. That's extremely important to understand. It's not just about alpha tocopherol. I refuse to use a vitamin E that doesn't have all 8 forms because the full 4 tocotrienols and tocopherols. So we know about tocopherols. We often forget about the tocotrienols. Very important for our immune and inflammatory cascade. So this is vitamin D. This is our pathway. And when I saw this graphic, I said, you know what, I have to include it. There's some fancy biochemistry here, but I just want to point out a couple things. First of all, I want to point out it comes from sun, but there's a lot of steps that need to happen for the pre-vitamin D to get converted from cholesterol to actually 25 hydroxy, which what everyone's testing in the bloodstream, and then the 125 hydroxy, which is the more activated form. The activation of this occurs, you can see here, in the liver, and then in the kidneys, this gets activated. And then finally, this form, this 125, gets incorporated into the vitamin D receptor. Remember this in the next slide when I talk about vitamin D genetic metabolism. And then from that, you can see the 125 actually has an effect intracellularly in the nucleus to create its gene expression. And typically that expression is your anti-inflammatory and antioxidant genes. This is extremely important to understand, and vitamin D is not just something that is important for bone health, as we all know, but it has a very strong effect on our nucleus. Similar to vitamin C, vitamin D has an impact on both the innate, which is our first line, and then our adaptive immune systems. And our vitamin D receptors I just showed you is incredibly important for that first line of defense. So for that first line of defense to be functioning optimally, we need to have optimal vitamin D receptors, which is what VDR stands for, and therefore it'll be able to be turned on properly. Vitamin D has a lot of other beneficial effects. You can see here from gut lining, microbiome, mitochondrial function, inflammation, and these are over and above, but synergistic to any sort of infection. So vitamin D, as everybody knows, extremely, extremely important when it comes to immune function. A couple of practical tips and notes about vitamin D. Number one, you have to get tested. We all know that. Hopefully everybody on this conference knows that. Number two, you got to get tested again. And what does that mean? That means that if you're low, just increasing vitamin D, I've had a number of patients that after they do a follow-up test, their levels do go up, but some actually don't. And this actually may be a sign that A, you have gut issues, absorption issues, but it also will tell you that you may need a higher dose or you may need to try a different way of getting it in. It's incredibly important to understand that you need to do a follow-up test on your first vitamin D test. This will tell you if you're on track. Oil-based, the research shows oil-based formulations, let's say in something like coconut oil, are better absorbed than dry caps, and especially if people have issues absorbing fat-soluble vitamins. Think of any sort of fat-soluble vitamin issues with anybody that's had a gastric surgery, like a gastric bypass, and definitely anybody with gallbladder issues. Just this last week, those were two big things that came up with some of my patients as we were doing virtual consults. And another key pearl out of the research is that people that have deficiencies and people that take vitamin D regularly, ideally daily, then second best is weekly, and then the worst is, once a month, a massive dose. Now that used to be something that was being thrown around as a potential treatment regime. It shows that you have the least beneficial effects when you don't dose regularly. So there's something about exposing our gut possibly to vitamin D on a regular basis. And then finally, genetics do play a role. And you can see here, and this is something that is a snapshot out of the My Blueprint test. There's multiple enzymes and there's multiple genes specifically and gene SNPs that relate to vitamin D metabolism. So both on the actual ability to activate vitamin D, remember converting it from 25 to 125, the active form, as well as potentially not having the VDR receptor and having as much density there. So these are all risk factors for having vitamin D deficiency, another reason why you should get your levels tested and may need to change your supplementation strategy. So I mentioned the mitochondria a couple of times. I mentioned it initially in the pathophysiology. I just wanted to put this slide in here to remind both of us to say mitochondria are incredibly important for viral infections, for managing viral infections, for the body sensing viral infections, and intracellular bacterial infections as well. So a lot of this is being talked in Lyme circles, is that the mitochondria senses, and I mentioned that whole DAMP and PAMP, this is pathogen-associated molecular patterns. Our mitochondria can sense that and will create the proper response. They become extremely damaged after a virus or intracellular bacteria takes over, and then they really play a big key role in allowing the inflammasome to be properly formed. If our mitochondria are properly functioning, then that is not as likely to happen. So don't forget about the mitochondria, and especially as we talk about something like N-Acetyl Cysteine. So NAC, we've all heard of it before. man, every time I look at the research, I'm really impressed. I'm really blown away. Some of the common things, like if anybody was attending this webinar, I was hoping that I would come up with some sort of dragon herb that would come out of the Amazonian jungle. It's simply not there. These tried and tested true nutrients, and in some cases they're referred to as drugs, as N-Acetyl Cysteine is for the treatment of Tylenol poisoning in a hospital setting. So I wanted to touch and spend a good deal of time on N-Acetyl Cysteine. So here is NAC. You can see it's made up of 3 amino acids. This is glutathione, and one of them is cysteine. And so we've always considered that cysteine is one of the rate limiting steps of glutathione production. You can see here, cysteine itself, over and above its ability to boost glutathione, is actually a key cell for our immune system. This is incredibly important to understand. The reason it's important is that we've always thought that glutamine is the main source of fuel for the immune system, as well as for the lining of our gut, etc. That is the case still. However, they play off each other. And it's funny that glutamine, or in this case glutamate, is part of glutathione formation as well as glycine. Think of all the things like glyphosates that are vying for getting rid of glycine out of the body. So this is, we might be supplying lots of glutamine, we might be supplying some cysteine, but if glycine is being deficient, which is why I'm a big fan of magnesium glycinate or magnesium threonate, which is a precursor to glycine, then this is where you run into trouble. So cysteine and glutamine can offset each other's deficiencies when it comes to immune cells. So we have to fuel, just like glutamine for the gut, think of cysteine as fuel for the immune cells. And it's depleted. Glutathione is depleted by oxidative stress as well as cysteine levels. So again, like vitamin C, you might get a functional local deficiency of cysteine, especially in cases of pronounced inflammation. We've seen this in cancer cases, but definitely in the cases of the immune system. And so you can see here, this is, the NAC is the key precursor to glutathione. So that's what that diagram shows. But it is not just about glutathione. So we like to think about N-Acetyl Cysteine as the key precursor for glutathione, and that's where it stops. There are so many other beneficial effects of N-Acetyl Cysteine over and above just, increasing glutathione. And these are some of those other direct effects. One of them is neurotransmitter production. Other one is reducing inflammatory cytokines. I can think of a couple conditions that would be helpful with. And then finally, nerve growth, BDNF. I've talked about that a lot. So N-Acetyl Cysteine does this almost in conjunction with glutathione, but also independently of glutathione. We've known about the mucolytic, the mucus thinning effects of NAC. This is a great little diagram. Again, a lot of this literature is in lung or pulmonary journals, but really good effect in mucolytic. And this is one of the reasons it can be very effective for sinusitis, chronic bronchitis, and any sort of viral infections, because again, in those further stages, you're going to get a lot of mucus production. NAC has both immune stimulating and immune modulating effects, and directly being antiviral. So some of this research is in vitro, some of it's preclinical, some of it's human studies. And there is research showing, again, NAC may inhibit the viral spread, again, by inhibiting that reactive oxygen species. So remember, going back to the pathophysiology, is that cytokine storm, that reactive oxygen species we talked about as a virus takes over and hijacks the cellular machinery, that is a necessary step for it to create its own replications and then spread throughout the body. If the body has adequate levels of cysteine, it can quench. The mitochondria has enough tools to quench these free radicals. And so that's one of the reasons that NAC has been studied. And this specifically was in AIDS patients, but it can apply to other ones. You can see the list here. We know that low glutathione impairs T cell activity and balances Th1, Th2. So this is its effect in stimulating glutathione. And NAC specifically is an anti-inflammatory and maybe even decreases fever. This is a great paper, and I have to give Dr. Alex Vasquez credit for bringing this to my attention. He's a very well-known educator, naturopathic doctor, chiro and osteo, pretty impressive resume actually. And this is a paper that I think is incredibly important. And it's funny, it's from Italian researchers, and it was published in 1997. Now think about that. That's a long time ago. And what this paper shows is that even at this time, there was 30 years that they've known about NAC being a drug that thins the mucous membranes. So this is 30 years before, this is in the 1960s and 70s. And this study does a really great job of highlighting a lot of things that are affecting us in this current issue, as well as in general viral conditions. So this is studying NAC on influenza, and they were studying it in elderly people, and about 60% of them were suffering from some sort of chronic degenerative disease, not respiratory disease, but just chronic degenerative. So they randomized, double-blind trial, and they gave them 600 milligrams of N-Acetyl Cysteine for 6 months. So they were using this as a preventative measure. And they found that there was a decrease in severity of influenza episodes. There was decrease in the morbidity, meaning all the symptoms associated with it, like being in bed, for example. And that is an incredibly important thing to understand, is that N-acetylcysteine, remember, it's not that the virus is not going to get into the cell. It doesn't work that way. It'll get in the cell, but it won't get into a severe replication cascade, and the cytokine storm gets out of control. N-acetylcysteine controls inflammation that's related to viral spread. This is a really, really important concept to understand, and we knew about this since 1997. This is a great paper. It's free if you want to access it online. Other benefits of N-acetylcysteine: protects heart, lowers homocysteine. Dr. Robin Murphy enlightened me on this, which was really, really helpful. So N-acetylcysteine has a lot more benefits than glutathione itself. And so this is one of the key takeaway points, and one of the reasons I'm a big fan of NAC is that it's very safe, it's less expensive, and it does more things than glutathione. There's a lot of fancy liposomal glutathione formulations out there, and we really don't fully know clinically whether it works. I'll be perfectly honest. I've used them quite a bit, and I haven't seen a massive difference. I've seen with patients that their lung function gets better after taking NAC, so we've definitely seen that. But it's important to understand is that the dose, again, like vitamin C, makes a big, big difference. So that study that I just showed you, that DeFlor study, basically showed 600 milligrams twice a day. So NAC from AOR is 500 milligrams per capsule. And if you notice, it's 120 capsules, and usually AOR is pretty good at putting in the amount of capsules that should be roughly as an evidence-based dose. So that's about 2,000 milligrams, and that's kind of on par with a good maintenance dose to starting to get into active treatment. So what the research is showing is that usually around 1,200 to 2,000 milligrams is a good maintenance dose. Now, most people that are clinicians are probably using that as their active treatment dose. You need to go a lot higher for that. So I've seen some, Dr. Vasquez believes it's closer to 8,000 milligrams or 8 grams of NAC in acute cases. And this is another reason why a lot of these studies fail. So again, this is a clinical pearl. This is not meant to be a treatment. I'm just relaying some of the research to you. Dosing on vitamin C and NAC do matter. And notice some of the cautions with the sulfite sulfur, but orally NAC is extremely well tolerated. And just a couple things. There are things that are vying for our glutathione and vying for our cysteine. We talked about those. This is the GSTP1 that's part of the panel that's done in the My Blueprint. And again, it goes to show you, this is a great little diagram that I'm going to show you here. Smoked meats, lack of good cruciferous vegetables, alcohol consumption, deficiency in nutrients like selenium, they all contribute to decrease in glutathione and therefore N-acetylcysteine. So you can see here, this is actually a printout of exactly what a person's report would look like. NAC is one of those key precursors to glutathione that should be considered, and understanding if a person actually has this GST-P1 or GST-T1 SNP, they may actually have a decreased risk, an increased risk for a deficiency in glutathione, not able to properly activate it and produce it. And NAC maybe, along with the research is pretty clear on cruciferous fruits and vegetables especially, will increase and kind of compensate for the lack of these particular enzymes. Okay, zinc. We're almost at the end of the orthomolecular section. So zinc, we know about it. I'm not going to talk about it at length. Everyone hopefully on the call understands why zinc is so important. The thing I wanted to point out is that it is very important at the initial phase of the entering into cells. So that's my takeaway point on zinc. It's important to be preventative with zinc and in the early stages. I'm going to summarize this as we go. But zinc is often overlooked. It's tough to test it. I've tested it definitely through standard labs, and unless somebody's majorly deficient, you're not going to see blood levels of zinc change. But definitely you can see it on hair mineral analysis as a potential option for treating. And definitely consider when using it long-term preventatively and making sure that the formulation, like AOR's zinc copper balance, has a bit of copper in it. Roughly the ratio is about 7 to 1 milligrams. And remember also, you do compete with other proteins and minerals for absorption. This is very important to understand. Zinc is one of those things that if you get into multi, you're probably not getting nowhere near the full benefit of zinc. So zinc ideally is taken on an empty stomach and away from other minerals and proteins because they do compete for absorption. Okay, melatonin. So I promised I'd talk about melatonin. You can see as you age, levels go down. And so melatonin, we think about it for sleep. It is a potent anti-inflammatory. It helps reduce inflammation. It reduces the inflammasome as well as NF-kappa beta. And there's research showing that it may actually reduce the damage to lungs. So again, may not prevent from an innate immune system, that initial infection, but it definitely stops it in its tracks and decreases the severity of it. So again, sleeping is a preventative immune strategy. And there's lots of research papers out there. I'm just pointing out a couple of them here for you. It's been studied in influenza. You can see here, this is a 2019, so just last year, talking about its immunobalancing effect. And anybody that does integrative oncology has known about this for a long time. You know, patients are confused. Why are you giving me melatonin? I don't have a sleep problem. Well, I'm giving it to you because it has been studied with chemo to reduce side effects. And some of the reasons is this inflammatory effect. And now we can apply some of that to infections. And so here's a great paper that, again, this particular study that I just cited will go through some of the mechanisms and, again, decreasing the inflammatory levels, for example, like IL-6, tumor necrosis factor alpha, that progress to more severe infections. So a couple of practical examples. You know, sleep is a huge one. Melatonin levels start peaking, 6 to 8 p.m. and they start going up. And then they kind of peak around 2 a.m. and then they start going down. So a lot of times people will take their melatonin too late. And so it's something important to understand. And it is something that a lot of things decrease the production of melatonin. So age is one of them, but it's also light exposure, light pollution, screens and Wi-Fi, both the visible and invisible, the blue light coming in through the screen and also the Wi-Fi electromagnetic radiations have been studied to decrease melatonin levels. The pineal gland in the brain is sensitive. It also is very sensitive to brain injuries. That is my jam. And so we talk a lot about sleep disruption after brain injuries, a lot to do with the pineal gland. So it's not just the pituitary gland where all the hormones come out of. Melatonin can be affected as well. And so I do recommend things like blue blocking glasses. I do recommend shutting screens off for 2 hours before bed, dimming the lights. All these things are practical strategies, as well as using, a formulation like OrthoSleep. OrthoSleep is a formula from AOR that has a long history of health, of beneficial effects. I think it's been around for like 15 years plus. A lot of people notice that they don't have to take it every single day. They can take it as needed, and it does have per capsule of 1.5 milligrams of melatonin. So it does have that melatonin to support our melatonin levels. Okay, endocannabinoid system. So this is the last thing I'm going to talk about in the orthomolecular system. And so some of you may in the fall have heard me do a webinar on something called PEA, the palmitoylethylene amide. And this is a substance that works on the endocannabinoid system. And hopefully a lot of you have got into this system, and I'm starting to understand its therapeutic value. Believe it or not, we still are trying to understand it. We don't fully know it, and we just have the evidence that we currently have. But one of the things that's really impressive about PEA is that it will support our body's endocannabinoid system without actually modulating CB1 and CB2. So it does it indirectly by increasing the body's levels of AEA, which you can see here right in the middle as the key player, and 2AG. So these two particular endocannabinoids are amplified by this fatty acid amide called PEA. And PEA is found all over the body, specifically in cellular membranes. So, a lot of tissues will be very rich in PEA, and they can become deficient if you are under chronic stress and pain and inflammation, because the body will increase the demand for PEA when it's trying to deal with any sort of stressor, and infections are stressors. And PEA has a potent anti-inflammatory effect. So I want to share some of that with you specifically as it relates to inflammation. Now, if you want to know a little bit about the anti-inflammatory effect, the mast cell stabilizing effect, the neuroprotective effect, I strongly suggest you check out the PEA webinar that I did in the fall. It's available on aor.ca. It is a deeper dive into this really, really unique molecule. Up until 2 years ago, I didn't really know about this molecule. We knew about cannabis and some of the cannabidiol analogs, but this substance has over 80 years of research on it and over 50 human clinical studies. I mean, I'm gonna let that sink in for a second. 50 human clinical studies, that is incredibly impressive when it comes to any natural health substance. And it's been studied in Europe for a long period of time. And there's a wide range of effects, and that's probably one of the reasons it's confusing to a lot of people, because it does so many different things, so many different beneficial things. But the things that I want to focus on are a number of studies that were looking at PEA as an immune modulator. Remember, CB1 receptors are primarily found in the central nervous system, where CB2 receptors are found in and on immune cells. And so in former Czechoslovakia, which happens to be where I'm originally from, so there's a bit of maybe nationalistic pride on my family's behalf anyways, but there were 6 large-scale human clinical trials, and I'm going to show them to you in just a second. And what they found is that they were studying PEA as a potential preventative and even a treatment for colds and flus, so the influenza virus. And what they found is that there was significant reduction in the symptoms of these particular infections. So fever, coughs, colds, malaise, lost days work. So again, a reoccurring theme here: vitamin C, N-Acetyl Cysteine. Now, PEA may not necessarily decrease the virus from binding. There are other things that may help do that, like zinc or even vitamin C itself and vitamin D. But what it may do is it decreases the intensity. Specifically, they found that it was the fever and the malaise that were most pronounced. And so when you look at this, these are not small studies. These are large-scale studies, and they were done in quick succession in very controlled environments with very significant improvements in terms of the protection of some of these immune-related and upper respiratory tract-related symptoms. And they actually studied it for 2 months. And so this PEA was shown to be effective and safe for that amount of time. So very, very impressive when it comes to its preventative immune effects, and may potentially be also used in acute cases. There are many other things that I mentioned about PEA, so check that out on the webinar. PEA has two options for you from AOR, and PEA is still in stock. It's something that I would definitely put in my immune support arsenal. I'm using it a lot for chronic pain, especially neuropathic pain. It's very effective for that. And I think it can be definitely part of our immune arsenal as well. 600 milligrams to 1200 milligrams is usually the dose, and that's around the 600 milligrams is the dose that was used in the studies in Czechoslovakia. It's also available in the Pro series as Pro Pain Relief, or in the retail line as Peak Pain Relief. And this has PA, you'll notice that, but it also has quercetin. So we're going to talk about quercetin next. But both of these substances have anti-inflammatory effects. And so the main indication of this formulation is for OA and other inflammatory conditions. However, could it be maybe used as a preventative for infections? And now what we know about inflammation, I think this formulation has a lot more implications, but again, this is clinical. So on the label, Health Canada has given us approval for just joint pain. So that's what we are marketing it for, and that's what I want everyone to understand. But my clinical opinion is that it could potentially be used for that. Okay, so let's switch gears and talk about botanical support. Let's see how we're doing on time here. Yeah, we're still okay. All right, so you've probably all heard about this. I'm not going to talk about this. Our former Prime Minister's brother, Michel Chrétien, is a researcher in the Montreal lab in the original SARS outbreak. He was studying a quercetin analog with a couple companies in biotech to come up with a potential treatment for the coronavirus. Now, things from there haven't really developed into some sort of treatment or even some sort of therapy that was being used by these biotech companies. However, this Maclean's article caught a ton of social media and media attention and really escalated into the point that it's impossible to find quercetin, and almost every single company is out of stock. Quercetin is not something you first think of for viral infections or any sort of infection. You think about it for allergies, would be the first one, maybe inflammation as the second one. It has potent antioxidant properties as well as many other ones, but a lot of this is in vitro studies and animal studies, and we haven't really seen that in humans. So, that's where we get a lot of this kind of in vitro data that it could be helpful for viruses. Unfortunately, the human evidence that we have is pretty weak. There is one study, again, similar to vitamin D, is that it may be more effective in at-risk populations and people over 40 at decreasing their total sick days. So this is maybe one of those examples where it definitely would be not the first thing that I'd think of, and I think this is one of those things that really the media blew things up. And quercetin is a very, very effective natural health product and an ingredient, but I don't know how effective it is for viral infections. I think in theory it might be, but I just want to share with you that in practice, might not see that. So some of the other things we talked about might be things to consider, but in general, a lot of great anti-inflammatory effects. Some of you may have seen this formulation called Mushroom Synergy. It was created as a formula that really was meant to be comprehensive, as well as included a couple of adaptogenic herbs. And I'm not going to talk about all the different mushrooms. That's been really covered really well in other presentations. So I'm just going to skip over to some of the key unique things, specifically the Astragalus and the holy basil. And Astragalus is one of those herbs that has been used for many years in traditional Chinese medicine, and in TCM, which is what traditional Chinese medicine short forms to, is something in China that is now actively being researched, specifically with COVID-19, and a number of TCM herbs are part of that research. So Astragalus has been traditionally used for viruses, and there is research supporting its benefit, boosting interferon, both gamma and alpha. It does have anti-influenza properties, but here's the unique thing about it, is if you're going to notice here, down in the antiviral actions section, you'll see that it may decrease influenza by decreasing the expression or balancing the expression of what are called TLRs, or toll-like receptors. Now, if you again go back to that first pathophysiology that I talked about, toll-like receptors are one of the key processes that the inflammasome gets started. Again, Astragalus may be helpful for that. So really, really great herb, one of my favorites. Traditionally used as like kind of a soup, a decoction is boiled. These kind of almost, they look like tongue depressor cuts of the root, but higher doses have definitely been used in viral infections. Another one of my favorites is holy basil. Holy basil, often thought about again more for blood sugar balancing, and in the Pro de-stress formula, which is in the Pro series, We've been pushing it a lot for the effectiveness of lowering anxiety, kind of having a calming effect, and its adaptogenic effects. So there is definitely good research on that. This paper at the bottom here in 2017, a great little review of the blood sugar, the adaptogenic, cognitive supportive effects, and also its immune balancing effects. You don't think of holy basil for its immune supportive effects, but you can clearly see here there's 3 studies showing its effects on immune balancing, as well as its effects on viral infections specifically. And that's what actually was used traditionally for a long period of time. So I'm a huge fan of holy basil, and I do incorporate it regularly, especially when there's a blood sugar balancing situation. So you can get it as a standalone from AOR at 500 milligrams, or you can get it in the Pro De-Stress, which is only available to clinicians in the Pro line. It's a little bit lower dose, but it also has theanine, and it also has GABA. So a really, really acute anti-anxiety calming effect. Excellent feedback from that from a lot of my colleagues sharing their feedback with their patients. AHCC. So since we're on the mushroom train, we can talk a little bit about AHCC. I just wanted to summarize it because one of the things about AHCC is that the amount of research on it, again, like PEA, is incredibly impressive. So I encourage everyone to visit this website, ahccresearch.org, and just take a moment just to peruse it for a little bit, to look at all the different research papers. And they've actually done a ton of citations there. And it really has, its claim to fame has been used a lot, especially in Japanese healthcare system for combinations with chemotherapy. So supporting the immune system there, but it also has antiviral effects. Really good affinity for the liver. Hepatitis is one of the ones that has been studied the most, but also upper respiratory tract infections. There's also a recent study looking at potential coronaviruses with AHCC. But AHCC is a very specific extract of fermented blastomyces roots or mycelia. It is a bit more expensive, but it is by far the most evidence-based extract of mushrooms, the very specific one. And so as a clinician, I always say, you know what, mushrooms are amazing to eat. You can definitely include shiitake mushrooms as part of your diet, put them in your soups, which is kind of a simple hot water extract. However, there's a huge variance in mushroom formulations on the market. One of them is fruiting bodies, one of them is mycelium, one of them is standardized to this percentage of polysaccharides, another one's not. Mycelium is no standardizations. Like, it's hard to make heads or tails of it. So if you want something effective, it is more expensive, but AHCC has been backed by a lot of research, and I often reserve it as big guns for chronic lung infections. And I've had a couple of just anecdotal case reports where people will come in and say, you know what, I couldn't clear that stubborn infection, and AHCC really did the trick. So that's something to consider. So check that research out, ahccresearch.org. Licorice root. Licorice root, again, is one of those long history of use in traditional Chinese medicine, and it has this potential effect against viral infections. It also has best known for its effect on stress. So we know how cortisol can impact stress. Specifically when it comes to viral infections, it has this direct effect at potentially decreasing the ability for viruses to adhere to cells. So this has researchers very intrigued, especially in the current situation. And glyceronic acid or glycerin is something that we've known and used for a long period of time, and it has a very synergistic effect. So something like OrthoAdapt, you can see this formula's claim to fame is really its high dose of glycyrrhiza glabra, which is licorice. Almost every other formulation on the market has either no licorice or very low dose of licorice. So you could probably consider, from a preventative perspective, OrthoAdapt, especially taken at its full dose of 4 capsules, provided you don't have any blood pressure issues, could be a very strong adaptogenic antiviral formulation. Eleutherococcus has its own beneficial effects on the immune system, along with withania and rhodiola. So I'm a huge fan of OrthoAdapt preventatively, especially under a lot of chronic stress. It's definitely something that should be considered as a kind of a key botanical strategy for general viral protection. Andrographis. So I'm going to spend a bit more time about this. I don't know, anybody that knows me probably has heard me talk about Andrographis. I know that the AOR medical team they're huge fans of Andrographis. We talk about that all the time. We hear a lot about echinacea, and I feel like echinacea is kind of like, well, you know, especially clinicians are like, I don't do echinacea. Or maybe you do, I don't know. But less people know about Andrographis and the breadth of research. I think now most people have heard about it, but they don't still fully grasp how impressive this herb actually is. It is extremely bitter. It's been used traditionally for common colds, fevers, and infectious diarrhea. So majority of its use has been all infectious. That should give you a clue from a traditional perspective. It also has antioxidant, anti-inflammatory, immune balancing effects. It has the ability to inhibit NF-kappa beta and increase NRF2. If people don't know what NRF2 is, it is a specific gene that is expressed to increase our anti-inflammatory and antioxidant enzymes. So it is kind of like the mirror of NF-kappa B. NF-kappa beta is the pro-inflammatory expressor of genes, and NRF2 is the anti-inflammatory. Anybody that's looked into broccoli extract and sulforaphane knows that NRF2 is like the holy grail that the broccoli family of vegetables target. Andrographis is number 2 on that list in terms of natural and botanical substances that stimulate NRF2. So this might be very effective in terms of our ability to quench intracellular inflammation. So that is kind of the actions. And so that would be kind of impressive if it was just that. But what is more impressive, like PEA and like N-Acetyl is the amount of research behind it. 33 randomized controlled trials. They might be more since I actually looked at this in 2017, looking at reducing the duration and severity of cold and flu symptoms within 3 days, so within a short period of time. So this is not preventative, this is actually treatment. So this was done in adults as well as kids, decreased days of work, especially sinus infections, upper respiratory tract infections where the virus is first hit. GI infections, UTIs, there's also evidence for that. And there's also evidence to show that it has an anti-metabolic syndrome action. Again, NF-kappa beta, inflammation, neurological issues, autoimmune issues. I'm going to show that to you in a second. Potentially increasing T regulatory cells and reducing Th1 and Th17 cells, which have been shown to actually increase inflammation. Antiviral research, again, this is a systematic review looking at 1,200 to 1,500 milligrams of Andrographis. Many other additional studies, I've cited those that references above. And then specifically with autoimmune conditions, a common question that I have is, can I take, a quote unquote immune booster? I really dislike the word immune boosting. Immune modulating is much more effective because you think Andrographis, because it has this effect of decreasing the severity and decreasing the duration and symptoms of colds and viruses, it will have an immune boosting effect. That is a misnomer. It does not. It has, like we talked about extensively through the presentation, it inhibits inflammation in some of the key pathways that increase viral replication and lead to longer symptoms. So it will still have a beneficial effect on autoimmune conditions. This is one specific example of that with specific ulcerative colitis. So let you read that over at your own leisure. Practical applications. AOR has an Andrographis exclusively in the professional series. High dose, you just really sometimes need 1 capsule, 300 milligrams, but this is a 15-1 extract. So it's like taking 4.5 grams. So this is an excellent antiviral and all the other beneficial effects of it. And it's 120 capsules. So it's one of those hidden gems, I think, in the AOR line. Tons of references for you to take a look at. So you can look back through the PDF for that. Okay, so I'm going to just finish off talking in the next 5 minutes about the gut immune connection and specifically how it plays a role in the lung gut connection. So this paper that I cited here might be a good one if you're interested in this. We've known about the gut-brain connection. I've talked about that. I've lectured on that extensively. And a lot of that has to do with the gut at the level of the digestive tract modulating inflammatory responses and basically regulating the priming of our immune system. So you can see here on the left side, this is the actual normal intestinal microbiome. So this is a healthy response over here. You can see this is dendritic cells, DC priming in relation to bacterial metabolites. Think of butyrate, think of pro or anti-inflammatory molecules and cytokines produced by a healthy microbiome. That dictates how your T cells, how your active or adaptive immune system is going to create, and that has a good response to a potential infection inside your lung tissues. Now think of a tissue that or system that has intestinal dysbiosis or an impaired microbiome. Poor diet, antibiotics, exposure to GMOs and glyphosate, you go down the list. Stress, you're going to have impaired priming, and ultimately you're going to have a poor T cell response is what's required to kill intracellular bacterial and viral infections. So my point being is that this is an example of a connection to the lung, but there is, a skin gut connection. There is a kidney gut connection. There's a lung gut connection. So don't forget about some of the common things. And I know NDs and I know a lot of clinicians that have experience understand this, but just wanted to point out, after we've gone through a lot of these botanical and orthomolecular nutrients, there's still importance of the foundational things, and the research is now starting to show this in a really, really important way. So a healthy gut will equal healthy lungs based on the inflammatory response. So researchers is now starting to look at that. So we don't know, could we? We still need more evidence for it specifically, but there is specific evidence, which I'm going to show you, that things that improve the microbiome and digestive function do have a role to play with our immune system. So the first thing I'm going to talk about is a specific probiotic. And I'm just going to glance over this research. We could spend a lot more time on it. This is a specific strain of Bifidobacterium longum, and this is BB536. It's one of the most studied probiotics in the world. It's over 100 scientific publications and 40 human clinical trials. Again, like PEA, impressive. Probiotics, it's a huge quagmire out there because there's a ton of probiotics that we simply just don't know what they do. We don't even know if they get into the areas that they're supposed to get to. That's what's so important to me about probiotics, and this is something that's shifted in my last probably 5 years of practice, is that I really focused on using strains that we know have therapeutic outcomes based on the research that has been done on them. We know the dose and we know that there's synergy. So I would actually use this particular strain maybe even by itself. And you'll see why some of the reasons that we want to do that. The graph on the right side here shows its stability in temperature. So it's actually able to be put in formulations that don't necessarily have to be kept in the fridge. Very, very safe. It's been studied in patients who are taking immunosuppressive drugs, pregnancy, elderly, infants. Incredibly impressive when it comes to some of the utility and the research behind this. Some of the specific research when it comes to the immune system is that this BB536 strain, it has the ability to increase Bifidobacterium, increase lactobacillus, and actually have an anti-pathogenic effect on bacteria that are typically dysbiotic. So remember back to the dysbiosis, these are some of the things that can become dysbiotic. There's also evidence showing that it decreases symptoms of intestinal permeability, so tight junctions, improves IgA, which is our first line of defense, and then cell-mediated immunity, which is the adaptive immune response. So it does both innate and adaptive. And there's AORs used it actually in formulations for allergies because it has the ability to decrease symptoms of allergies clinically, not just the theory of it in terms of improving gut integrity. And that has to do with, again, balancing Th1 and Th2 levels as well. So really well studied when it comes to the immune system. And this particular study, again, looking at it, its ability to have an influenza prevention in both children and elderly. So if you're interested in knowing more about this probiotic, check out some of the research that I just shared with you, and really the information's out there. It's available in a number of formulations that AOR has, but GI Repair in the Pro Series, which is an exclusive product, is an excellent product that shows its benefit for the integrity of the gut as well as the immune system. So glutamine, zinc, The BB536, it has DGL in it. So DGL will help the integrity of the gut, but it won't help the immune system because DGL has that glycerin, the actual immune active component, taken out. But gut integrity, very, very, very effective formulation. And recently the flavor on this formula was improved to kind of this calamansi lime, which is a Thai lime. It tastes almost like a margarita when you have it with a lime. So really nice morning drink that you can cycle in with kind of the lemon water for patients in the morning. Colostrum, I'm not going to talk about that. We've known about that for a long time. Great for the gut function, but lots of immune benefits associated with it as well. Check out AOR's website for more information about colostrum and lactoferrin. Unfortunately, out of stock, extremely popular in China. Lactoferrin has a lot of immune benefits, and you can see some of them here. I don't have time to go over all of them, but gut plays an incredibly important role. And finally, this is a really novel, unique way, but we talked about the lungs as being the ultimate target of a viral infection that can cause real big issues, but the throat and the nose is the first place of being affected. So probiotics that address not just the gut microbiome, but also the oral microbiome could be of beneficial effect. And so this formula contains Streptococcus salivarius, and it's called Bliss K12. And Bliss stands for bactericidin-like substances. And what these basically do is that this specific strain of probiotics increases these Bliss substances that actually kill bad bacteria, and healthy bacteria are not affected. This is a lot of research coming out of New Zealand, specifically for ear and throat infections. And it can be very effective in both adults and kids. And a lot of that has to do with this unique Bliss molecule that is Streptococcus salivarius K12. Again, that specific form of the strain, having an antimicrobial effect that's targeted at especially strep bacteria. But as you can see here from the evidence, it's also viral mediated pharyngeal tonsillitis was decreased by 80%. So this was preventative, taking over the period of a year. And there's a substantial decrease in the K12 supplemented group compared to the untreated group. So just wanted to offer you another unique perspective that we can influence the not just gut microbiome, but we can influence the oral microbiome in a very specific antimicrobial way. And there's some really innovative, neat ways of using some of these strategic probiotics, both BB536 as well as Bliss K12, to having a very specific effect. So let's wrap up. I know that was like a bit of a whirlwind and I covered a lot of things, but everyone does have the PDF, so they can look at that at their own leisure. Obviously, please don't distribute that. That is something that is proprietary to myself and to AOR. But I do want to conclude in the sense of, we talked a lot about different lifestyle things. I touched on sleep multiple times. I touched on stress. I touched on the vagus nerve, things like humming. Don't forget about those important things, especially if we're physically isolating. Mitochondrial function is key. That is something that wasn't really clear to me years ago, but now it really is. And it has to do with regulating the sensation of pathogens and danger cell signals, and regulating the inflammatory response and the inflammasome. If you can regulate the inflammasome, you basically help the immune system keep the infection in check. It can't take over the cellular machinery. The initial onset is probably where we're going to have the most effect. Once we get to the point that a person has pneumonia from a virus, a lot harder to treat. So early, a little bit more proactive and being aggressive and being preventative can definitely be helpful. We talked about things like green tea. We talked about things like humming, gargling, all improve the vagus nerve, which improves powerfully the body's ability to combat inflammation. And I left you with this little diagram and chart. It's partially finished in the form that you have, but I think you'll get the picture of it. Vitamin D, the reason, some of the doses. We talked about how regular doses of vitamin D. Another thing important, that the point of vitamin D that I forgot to mention, is that people that were deficient found the most immune benefits. So if you have adequate levels of vitamin D, I think the key thing is you just have to maintain those levels. You don't need to take massive doses to have some sort of antibacterial, antiviral effect. Magnesium I did not talk about, but think about it from the perspective of mitochondria. Most people are deficient. It's something I could have talked about. It's overlooked in the immune system, but it plays a key role in mitochondrial function. Talked about vitamin E, use all 8 forms. Zinc, really important from the early preventative stages. Vitamin A also didn't talk about, but I have to mention it because it is a key part of the synergistic vitamin C, vitamin A, vitamin E orthomolecular approach. Incredibly important for mucosal immunity and antiviral activity. And finally, PEA is really a new kid on the block that I think everyone needs to know about as it relates to chronic pain and inflammation, but also immune function. So if you haven't had a chance to use that or check some of that research out, there's a lot of great resources on aor.ca as well as the webinar. There's a white paper for clinicians that's available, so talk to your medical advisor about that. And there also is not a white paper, but a Truth Series magazine that's available for everybody. You can download that off the website. And probiotics, N-Acetyl Cysteine, we talked about that at length. So these are kind of the key foundational things to look at. So that's what I want to leave you with. There's a couple of resources from AOR, so I want you to reach out. I believe these were sent out by your account representatives. There are summaries of some of the formulations that are available for immune function. You can see them here. I talked a lot about them. Notice there's NOx boost here, the nitric oxide. That is why that formulation's there. A lot of the stuff I talked about, and hopefully you have a much better understanding of the research behind it and some of the reasons why you might want to be considering it or recommending it to your patients. And finally, a monograph on quercetin, which we've talked a lot about at length, and definitely there's a buzz out there. So hopefully that was really fun sharing that with you. I know that making this presentation was really fun. So thank you everybody for joining me on it. We are going to open it up for Q&A. I'm sure there's a bunch of questions. And so please put those in the question box. But I'm going to answer some questions. I'm going to turn it over to Dr. Nibber for her to moderate.
Yeah, thank you. So we got a lot of good engagement throughout this. One of the questions was in relation to formulations of vitamin D and the risk of oxidation when it's in the oil or soft gel cap. Does the veggie cap ever offer more consistent dosing? What are your thoughts on that?
It's a great question. I've been talking a lot about with my patients as well about the types of vitamin D they're using, and the reason being is that there's a number of factors, as I mentioned, in terms of absorption, but sometimes they don't get the benefits that we're expecting. And so in that case, I'm always saying, all right, what form are you using? Where are you getting this vitamin D from? And sometimes I've seen, and this is my experience, is that not every form is good and it could be oxidized. And I think that we have, when you have something inside a soft gel, you do have more protection, but in general, an oil still is probably going to be offering you a beneficial effect. And the reason has a lot to do with the fact that the company you're buying it from hopefully is doing testing. And I can only speak on behalf of AOR, but the stability of the oil-based formulation, even over time, has been something that AOR has been tested. We have a stability chamber, so we're looking at it as it's exposed, as it's been open, how long is it going to be there after at the end of its shelf life, within still its expiry. So I think it has a lot to do with the quality of the raw material and the testing that's being done. But I think if it's consumed within a month and not left, in there for 6 months, then your risk for oxidation from a capsule is probably pretty low. From a liquid is pretty low.
Okay, excellent. Thank you. Another really great question was in regards to the other vitamins and mineral cofactors for PEA. Are there any, and is there anything that we can add on that would be a nice synergy with the PEA?
Oh, that's a brilliant question. I've described PEA being very similar to the way that omega-3s work because they get incorporated in the cellular membrane. it being a fatty substance, I would be looking at making sure we have good fats and specifically vitamin E. But this is just my opinion. I have not seen any sort of research on some of the synergy associated with it. So I can't say if there is anything, and they're probably, from what I can tell, I can't make any sort of recommendations. Now that I'm thinking of it, though, there's research on PEA in combination with bioflavonoids. So luteolin is one that's found in a number of plants, and there is some evidence pointing that it may actually be more beneficial when taken together. So I don't know if that's luteolin having its own effect, or there truly is a synergistic effect, because those studies have never been done like PEA by itself. But I think using it in the context of bioflavonoids, usually vitamin C does a pretty good job of always protecting things, whether it's nitric oxide or whether it's or the nitric oxide precursors like beet juice, for example, or green tea. I think PEA would also be a good candidate for bioflavonoids as a complementary nutrient.
Okay, thank you. So there's an interesting question in regards to some of the contraindications of NAC, if you could speak to those, and its use in children and adolescents 9 to 12.
Yeah, NAC is one of those substances that has been studied extensively, and it's been used in various forms, orally, nebulized, so in inhalation, as well as IV. IV and nebulation has more risks, so that's something that's usually reserved in a clinical or hospital setting. Orally, from what I'm looking at, I'm trying to remember, definitely something. I know that it's being used in kids. I know that I've used it with my patients, and that's something, again, I think we have to look at clinically. I can't think of the particular research studies that have used it with kids, but definitely I know a lot of autism practitioners and people that are working on neurological health will use it. The problem is that, you can't really consume it easily. So there are some dissolvable forms of NAC that are on the market, and that's not something that AOR has. But so officially we recommend it only for adults, but talk to your practitioner about actually getting it in a form that a child might be able to use.
To mushrooms, everybody's favorite topic. So mycelium versus fruiting bodies. Is there a preference for one or the other, or would it be dependent per type of mushroom?
Yeah, you know what? It's a controversy a bit, depending on what practitioner and depending on what company is actually giving it to you or touting it. I know some really reputable companies that all they do is talk about mycelium, and then there's some that have fruiting bodies, and the research has been done on the fruiting bodies or mycelium. So, just me in a perfect utopian world, I always ask for, can we do both? Because there are different therapeutic compounds in mycelium that you're not getting in the fruiting bodies. Definitely look for hot water extracts, definitely look for standardizations. Those are key things. The problem with mycelium is you can't get a standardization because they change so much. And so that's why AOR has chosen to go with fruiting bodies in their mushroom synergy formula. ACC is a much more specific extract, so you're going to get the highest standardization there. Even though that is a mycelium, that is something that's extremely regulated, so you can actually get some sort of specifics on the alpha beta glucans that you're getting in that. And so I would say the jury's still out. We don't know, maybe using both, but I still think there's beneficial effects that I see from both forms.
Okay, perfect. And then in terms of mushrooms, we've got a few more questions about use in lymphatic diseases or lymphoma. I don't know if you can speak to that.
Lymphatic diseases and mushrooms. Yeah, honestly, I can't speak to that very much. I don't really. That's not something that I would use them for. I'm not sure, to be honest.
Mm-hmm. And then we had a question in regards to zinc and taking it. I'm sure lots of people have tried taking it on an empty stomach versus with food. You did mention empty stomach because it's in competing for absorption. Now, how would you recommend people mitigate some of that nausea?
Yeah, that's a good one. You have to take it with food. I'm one of those ones that, if I can't take zinc on an empty stomach, things like zinc carnosine, which are forms that are found in, like the gastro relief that AOR has and the Pro GI repair in the Pro series, I find they are better absorbed and better tolerated because it's an amino acid form. Same with magnesium synergy. It believes I use a zinc malate, so the absorption's higher. But other forms of zinc are going to be a little bit more aggressive on your stomach. The people that are sensitive, some people can handle it no problem. I typically recommend taking it with food if it does get those symptoms, and you could try digestive enzymes as well. But sometimes people are very sensitive.
Okay, great. And actually, on that note of, the best way to take certain things, we have a question in regards to probiotics and if they work better if the capsule is opened up and it's actually left to dissolve on the mouth. And I know you can speak about the lava rocks, maybe for that.
Yeah, I think that it depends on the probiotic, right? So like something like the Bliss K12 is designed for that. So obviously that's a no-brainer. Yes, you should. And you want to coat the mouth with that. Like something like the BB536 has research on the stability of it. And so if it is stable, you have less to worry about. So you can have it in a regular veggie cap. A lot of companies, I've seen this, they go one of two ways now. They go either with spore bacteria, and we still don't really know what those do. And that's the unfortunate reality, is that they seem better because they only open up in the area and they bloom in the digestive tract. And the theory goes that that's the way that we are normally consuming it in nature when we're eating dirt and our ancestors ate dirt, and that's some of the richest microbiomes diversities are people that are exposed to a lot of spore bacteria. But we still don't have the depth of clinical research on it. So that's why AOR has not gone with spore bacteria, and was gone with specific strains like the BB536 that has gastric stability, that has temperature and pH stability. And so in that case, it doesn't matter if you open it up. You could, like I have a lot of NDs, I've used it before myself, that will actually open up a capsule of probiotics and allow it to coat the mouth, because that is where we want some of those effects. And at that point, it's not colonizing, but it's just having a competition symptomatic relief effect. There's also a theory out there that when you are exposed to probiotics, even if they're dead, that the immune system sees them and basically creates an autoimmune reaction to them locally and decreases the pathogenic bacteria in the gut. So that's just a theory that's now being looked at. But probiotics are a lot more nuanced than just take as many as you can, 50 billion, and you're going to get beneficial effects. That's not nearly the case. You need to look at forms and strains that have been studied together, like the probiotic 3 that AOR has. That's a phenomenal combination. 50 years of clinical research on the combination of the 3 strains. And those are ones that have excellent stability, gastric stability, acid stability, pH, temperature stability. So you could open them up and you could take them in the mouth, but that could not apply to a regular probiotic that has to be kept in the fridge and then is not going to make it down through the digestive tract, especially if they're using a capsule or some sort of fancy technology of delivering it in the right pH, which assumes so many different things. Most people don't have the right pH in their stomachs in the first place. So that's why we've gone with the evidence-based way that we have.
Okay, perfect. Could you speak to astragalus during fever?
I don't really know specifically about fever. I would say elderberry would be one that I'd be looking at. N-Acetyl Cysteine potentially is antipyretic. Astragalus, if you're feeling ill, then you definitely could be using it. But I have to say, like, once people get to the point that they're in the bed shivering with a flu, at that point, a lot of the herbs it's past its time, type of thing. You almost need to be early stage preventative, prophylactic, and then at that point you're switching to things like vitamin C and N-Acetyl Cysteine that are regulating the inflammatory response. And so a lot of the herbs I mentioned, so andrographis and astragalus, does have those kind of immune balancing effects, so it could balance fever. But we don't have as much evidence on that as more of on the prevention side. I do also see a question here about N-Acetyl Cysteine safety. I'm glad it was brought up. You know, I mentioned with licorice, high blood pressure is a big one. Anything that I mention here always has to be in the context of a healthcare practitioner. These are not treatments. This is educational in nature, number one. Number two, N-acetylcysteine orally has been shown to be very, very safe. In children, we don't know that. That's why you have to talk to a clinician. So that's why I'm not commenting about that. But in general, N-acetylcysteine is very well tolerated. I've had a couple of people say that they have some headaches, but that could be a sulfur sensitivity because it does contain a lot of sulfur compounds.
Mm-hmm. And actually, on that note, are you aware of anyone who's using nebulized glutathione or NAC in hospitals right now, just with
Not in
everything going on?
hospitals. I know that would be something first line that clinicians that I know would be using, including myself, if we were able to treat it, but we're not. So I'm not aware of that, but I'm only aware of the vitamin C intravenous trials that are happening right now in China and also potentially just being used in New York.
So just shifting more into kind of the epidemiology of COVID and some of the pathogenicity there, we have a few questions in regards to if, you know, seasonal flu is going to increase or decrease risks of susceptibility. Do you know if there's many of those studies being done with the comorbidities or, you know, how we're building immunity?
Yeah, it's a good question. I understand where it's coming from. I've had it myself. I don't know, to be honest, and nobody knows. Nobody knows what is going to happen. I mean, there's a number of ways that can, you know, that viruses and managing virus pandemics work in terms of on a population scale. Social and physical isolation and distancing are applied early, and the virus basically stops being spread to other people, and there's no herd immunity that is created. So this is where like things like Ebola and SARS-CoV, the first original one, and Middle Eastern respiratory syndrome, these other epidemics that have regionally broken out, this is how they've been controlled. We don't have, a SARS, the original SARS. We don't have herd immunity to it. The second way to deal with it. And by the way, on that first note, I think we may be past that, and a lot of experts also think that it's a little bit too late. It's gone global and there's community spread. So the second way is that you're hoping that you get some sort of vaccine and then you control it as well. So it's kind of a combination of and then also adding in a vaccine, which may add in immunity for other people. I have to say, a lot of experts, and this is just me not being an immunologist, but what I'm reading is that a lot of the vaccine development for the coronavirus as a family has been very, very poor. Coronaviruses mutate often, and they have a specific design, this encapsulated virus that is really resistant to vaccines. So we don't know. We're hoping that happens, but there has to be proper safety data and research being done. And then thirdly is the influenza model, which is herd immunity. Everyone has it or it's gone through the population. The people that get it will develop the immunity. So, you know, that is maybe what the Swedish healthcare system is taking. We don't know, but I think, you know, that's what it's probably going to end up having to be. We don't know if this is going to hang around like the common cold or it'll be the new influenza. I'm not sure, but that's just my comments on what I understand so far.
Right. And in any of the cases, we always have to make sure that the healthcare system can, you know, handle the burden of care that will come with any of those scenarios. So again, the social distancing right now for sure makes sense. Okay, we have a few more questions about if one doesn't necessarily need the NAC or it's not indicated. I don't know exactly what they mean by need, but could it possibly dry out mucous membranes and disrupt biofilms in the GI tract, disrupting the microbiome?
It's a good question. The evidence points to no. I think that it's almost like in cases of excess mucus, it will break up those sulfide bonds. But if the mucus isn't there, especially in excess, it's not like it will dry things out further. Based on the research, and definitely in that one Italian study that I detailed, It was taken for 6 months, and very little. It was very well tolerated, very little side effects. I mean, clinically, I've seen a couple of cases where people notice a little bit more dryness, especially in the winter time in Canada, where it is pretty dry when we're staying indoors. So, I mean, that's something that maybe you could keep an eye out for. But in terms of disrupting biofilms, no, I don't think so. I have not seen any research around that. And I think that it does, because of its effects, and unlike something like garlic, or unlike something like maybe echinacea or oregano oil, which has a very potent, like oregano oil, especially because it's an essential oil, is extremely effective at penetrating into biofilms. Those essential oil hexane rings are really good at doing that. And that would be something that we know disrupts the microbiome. I have not seen any evidence of NAC disrupting the microbiome. Maybe that research hasn't been done. It should be done. But I think mechanistically, it's just supplying cysteine and making sure that you have ideal levels in the same way as glutamine. And I think, I think that the disruptions are happening on a much kind of lower, less, interventional scale, that we have to worry about disrupting good bacterial biofilms.
Oh yeah, that's quite interesting, because I know in a lot of SIBO protocols they're using that NAC.
That's right.
For that at very high doses. So yeah, it's interesting that there's not as much research.
What are the doses, by
So
the way, that are being used for that, Dr. Nibber?
1200 milligrams BID, so very, very high.
Yeah, BID, so 12, yeah, okay, that's about 3 grams ish. That's decent, but I think most people are underdosing in general acutely, because SIBO would be an acute case, right?
And actually on that, maybe there's an opportunity to clarify. I think earlier you had mentioned that elderberry can increase the cytokine response, but this individual is asking if the cytokine storm is actually causing most of those issues from the viral infection. Why would elderberry, why use elderberry during the cytokine storm instead of prevention?
Well, I saw that question. So firstly, the research doesn't show that elderberry does anything from a preventative perspective, from what I understand. So that's based on the evidence. Number two, I think it's used early on. Some infections and viruses don't have such a pronounced cytokine storm. So I think it's important to understand that what may be true for COVID-19 may not be true for influenza. I think a lot of people are hospitalized for influenza, but it does not have nearly the same type of virulence and affinity for the lungs as it seems COVID-19 is. So I think that's why, using it early on in a viral infection is where it's been traditionally studied for. But again, this is in theory. I've listened to other experts online in YouTube videos talking about how elderberry, the issues with elderberry being limited is nonsense. So talk to your doctor about that if you have any questions specifically, but I'm just sharing with you the evidence that was being circulated and what we currently know. So yeah, I think that hopefully answers that question.
Yes, absolutely. Okay, well, it looks like we are coming to the end of this webinar. It's been extremely informative, so we're going to stop the questions there. I want to thank you so much. Every time I listen to this presentation, I gain more clinical pearls, and there's just such a wealth of information, so we really appreciate you taking this time and building that presentation for us. If anyone does have any additional questions or they missed something, a recording will be available through your customer portal, and you can email any additional questions to marketing@aor.ca. That's marketing@aor.ca. We are continuing our educational series. The next webinar will be on April 14th at 12 p.m. Eastern. Dr. Chantal Dumas will be presenting on optimizing your digestive health and building a healthy gut. So if you're not yet registered, please go to aor.ca/webinars/B2B, and that's the number 2, not TUO. Thank you again. It's been really great. I hope you all stay safe and healthy, and we will see you later.